So when you inject ozone into a joint, do you get some kind of inflammatory reaction initially? Do people get possibly exacerbation of pain or swelling? Like, what have you seen?
Well, when I learned in Germany, what you do is you just take a needle, put it in the knee, shoot ozone in. And when I say knee, that could be ankle, it could be finger, it could be shoulder, whatever. And you shoot the ozone, just the ozone gas in, and the knee gets better.
Mm.
After I did that a few times, I realized it hurts like heck. Ozone is a little irritating. So you put that into a knee that's already irritated, it hurts like heck. So then I got to thinking, well, if it were my knee getting injected, I think I'd want to shoot some Novocaine in there first. So at that point, I had already studied in Germany and learned about this treatment called neural therapy. Neural therapy is another form of treatment for pain, which involves injecting Novocaine into areas of pain. Turns out that Novocaine, although everybody knows it as a local anesthetic that dentists would use to do what they're going to do, it also has the property of healing. It has a very healing property to procaine. And it does what we call stabilize damaged membranes, which is part of the reason things won't heal, because the membranes are damaged. So I thought to myself, well, look, why don't we put some procaine in, or some Novocaine in there? It'll stabilize the membranes and it'll numb everything up so that when I shoot the ozone in, it won't hurt. And so I started doing that, and I started calling that Prolozone.
I see.
Because of the procaine and the ozone. So we started putting those together. And then after a while, I started realizing, if I'm going to be injecting procaine, which is a liquid now, so the needle goes in, we inject the liquid, the needle stays in, I switch the syringes, shoot the ozone in, then pull the needle out. I thought, as long as I'm injecting a liquid, what other things could I put in there that might help? And that's been a transition over the last 20, 30 years where we've gradually learned that putting a little glucose in there works really well. Putting some B vitamins in there, particularly thiamine, works pretty well. Putting some trace minerals in there works well. There's some anti-inflammatory homeopathics. And so basically I created this sort of recipe, if you will. It's like making soup. The key ingredient is ozone, but these other ingredients make the process better so it doesn't hurt at all. In fact, people will come in, they'll have pain for the last 20 years. When they leave my office, the pain's gone. This is typical. This is very typical. It's not unusual. So they get immediate response, and then it stimulates the healing, and it even works better than the ozone by itself.
I see. Amazing. So you would inject the ozone and then you inject the rest of your recipe.
Yeah. Exactly. So now I've evolved to the point where this is what's common. I'll inject ozone in there, and in using this technique with the procaine and the vitamins, shoot the ozone in there. Then I'll bring them back in a week. And once I've prepped them with that, I'll do the same thing again, and I'll put in what's called platelets, PRP, these platelets, which have growth factors in them. So I shoot the platelets in there. Then I bring them back in 4 weeks. Now, very often when they come back in 4 weeks, they're completely well. That's the end of that.
Wow.
Done deal. Walking normally, no limping, out doing whatever they want to do, dancing, skiing, whatever they want to do, everything's just fine. But if they're not, at that point, I'm probably just going to shoot some stem cells in there, because what's going to happen is prepping that knee is going to make those stem cells work a lot better. And, the audience should understand that stem cells are expensive. That's just the way they are. And so you don't want to waste them. You want to make sure you get the most bang out of your buck on these stem cells. And I've found that if I pre-treat with this ozone technique, I get really much better results with everything else. So now I've got procaine mixed with all that stuff. I've got ozone, I've got platelets, and then stem cells. I mean, there's nobody ever gets sent to surgery. It just doesn't happen. The only time my patients ever go get surgery is when they say, you know what you're doing is expensive. It's not covered by my insurance company. So I'd rather go get the $30,000 surgery since it's covered by my insurance company.
Right.
Yeah, that's the only reason they go to surgery, because like pretty much 100% of the time, we're going to take care of this.